Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what a lesionectomy is, what are lesions, congenital versus acquired lesions, pre-surgery, surgery, success rate, and risk. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. As medical technology advances, those with drug-resistant epilepsy now have a cure through surgical procedures. Structural abnormalities, also known as lesions, can be surgically removed to provide patients with seizure relief. A lesionectomy eliminates any irregularities that may be causing seizure activity. A lesion is a damaged or abnormal functioning area of the brain caused by past injuries, infections, or wounds. Lesions can include brain tumors, abnormal blood vessels, scars from head injuries or infections, swelling of blood vessels. Lesions can come as part of two subcategories, congenital and acquired lesions. Congenital versus acquired lesions. Congenital, lesions that are brain malformations that develop before or during birth and are present throughout one's life. Congenital lesions include cortical dysplasia, abnormal brain folding during development or failed cellular migration during fetal brain development. Vascular malformations, abnormal blood vessel development. Congenital versus acquired lesions. Acquired lesions are brain malformations that develop after birth. Acquired lesions include brain tumors, strokes or brain infections, brain injuries, and conditions. Pre-surgical evaluations will take place to make sure you qualify for a lesionectomy. These tests may include seizure monitoring, functional and high-resolution MRI scans, positron emission tomography scans, magnetoencephalography test, WADA test, SPECT, or electroencephalogram monitoring. During these tests, the doctor will pinpoint the lesion and ensure they can surgically remove it without harming other tissues. Upon arrival at the hospital, someone will take your vitals and blood for testing. Your doctor will provide you with specific guidelines on what to eat, if anything, before surgery. Someone may also shave a portion of the head to access the brain during surgery. A lesionectomy depends on the patient, the lesion, and the lesion location. While surgical plans may differ, surgery generally proceeds as follows. The patient arrives at the hospital on the morning of the surgery. General anesthesia is applied along with an IV. The neurosurgeon makes a window through the skull. Thin probes guided by MRI access the brain. An endoscope and laser burn and remove the lesion. The bone window is replaced and secured. The incision is closed. The patient spends the night at the intensive care unit and then 3 to 6 days at the hospital. Sometimes a post-operative MRI is obtained and follow-up visits will occur 1 to 2 weeks after discharge and then at 6-month intervals after that. When surgery is successful, a person may become seizure-free. However, depending on the type of lesion and location, the success rate will vary. For non-mesial temporal sclerosis lesions, the general rate of being seizure-free after a year was 63.2%, 50% for focal epilepsy, and 66% for mesial temporal lobe epilepsy. The rates for children are much better. An astounding 81% of children with a lesion on an MRI became seizure-free. Since a lesionectomy only involves removing a lesionectomy comes with a lower risk than many other brain surgeries. However, the stakes will vary by lesion type, location, and size. Some lesions also possess the ability to grow back, meaning a second lesionectomy may be required. After the surgery, a lesionectomy may result in blood clotting, brain swelling, damage to healthy brain tissue, blood loss, infection, or reactions to medication. The patient will most likely require pain medication for several weeks. Side effects from surgery may include fatigue, depression, headaches, numbness in your scalp, nausea, and trouble with memory or speaking. In general, a lesionectomy is a surgical procedure that can significantly reduce the occurrence of drug-resistant seizures. The surgery is less invasive than others since it only removes lesions from the brain. Like most surgeries, risks come with the procedure. You should consult your doctor to determine if a lesionectomy is best for you. To learn more about lesionectomies, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.